Hello, I'm Dr. David Berv, and we're here at the Float Zone with Diane, who is participating in a case study on flotation and traumatic brain injury. And so, Diane, tell us a little bit about the injury that you had over 10 years ago.
So I just had my 10-year anniversary a few months ago. The injury itself was a result of being dropped on a concrete sidewalk. My head right here was the point of impact. I had about a 9-inch skull fracture that the doctors presume sliced an artery on the exterior of my brain, causing internal bleeding. So I had a blood clot between the brain and the skull that was relieved by an emergency craniotomy, drained the blood, cauterized the wound, sewed me up.
And then how quick were you back to your normal actions again?
So surgery, hospital for about 3 days, resting at home for the remainder of a 2-week period. It was my senior year of high school, so...
Or college, you mean? Senior year of college?
Yes, senior year of college, and I went back to school after
pretty
2
soon
weeks,
afterwards. And then you had, what other kind of medical follow-up did you have after that?
Very practical surgery, like the medical aspects of the surgery related follow-up. So they checked the stitches. They would ask me very basic questions like, who is the president? Do you know who you are? What's the date? And I checked off. I was very alert and aware and seemingly back to normal pretty quickly. So nothing was done besides those practical follow-ups. I had 3 scheduled, but I only ended up going to 2.
And then you went back to your classes. You ended up, I think, dropping a class.
One class.
One class
Which
at the time.
I didn't have to drop.
And then, okay, but then what gave you the insight that maybe there was something going on outside your normal brain function?
Well, it was really interesting because everybody was telling me I had been through something traumatic, but for me, I felt pretty normal still outside of this sense that my thinking changed. Like the way that my thoughts worked internally were different. And so, but
it wasn't until years later that you actually had any testing done, is that right?
So by my own curiosity and desire, I requested to get a neuropsychological test done 6 months after the accident. So they tested memory, auditory sensitivity, visual acuity. All of those results came back either high, average, or superior. So they essentially were like, you're good.
Mm-hmm.
And I did feel good. I felt very normal. But that sense of my thinking being different still nagged me. And it never went back to normal. It was my new way of thinking, and it has been since the accident. So I just kind of continued along, never saw any other doctors, I never had a doctor to go to. The surgeon was the surgeon, and that was that. And so I had another neuropsychological test done, the same test, about 7 years later, because I had been suffering some brain fog and memory concerns, and I felt the need to follow up. But again, I searched.
You searched, but for lack of putting words in your mouth, there wasn't really a lot of direction for you or a lot of management for your condition.
Yeah, I did not have a case manager at all.
And so then, 10 years later, I guess, Diane and I meet in the post-float lounge at the Float Zone, and she was referred here by a friend that's also floating here for traumatic brain injury and with regard to flotation. And so Diane and I talked for a while in the post-float lounge, and we decided to engage her also in a case study on flotation and traumatic brain injury. And we decided that we were going to have Diane jumpstart into 30 days in a row of floating. And so tell us a little bit about the impact of that 30 days in a row of floating and how that kind of changed your perspective.
It's very hard to summarize it in a sentence or two because the impact was so really profound, and I gained so much from it. But I think that the easiest way to summarize it is a level of awareness that I gained about myself and my own cognition, like how my own brain works. Floating is very much like meditation, and I've been practicing meditation on and off since college. And the experience in the tank is essentially like it's hyper meditation. I don't know exactly how to describe it, but anybody that's ever tried to sit for 10 minutes, especially if they haven't done it before, knows how difficult it can be. And the tank is an hour worth of time, and everything that could distract you except for your own brain is eliminated from the picture.
So yeah, so you and I determined a lot of where your deficits are, whether it be through sleep issues or through anxiety or through some other types of cognitive things. But it was obvious through the data too that many things changed this first 30 days. And just tell us really quickly from a sensory standpoint, you had mentioned that your hearing changed a little bit, your sense of smell changed a little bit. Not that those were your major things, but I find them interesting that they changed.
Right. There was definitely fluctuation in my experience of it, most pointedly around the sense of smell. My normal sense of smell is very dull. I don't have a good one. And there was an increased sensitivity to scent that I noticed and experienced, throughout the 30-day period. I have very sensitive hearing already, and that increased some, but not as pointedly as the sense of smell, which was something that I, felt like I didn't really have much of before.
Great. So we'll talk a little bit more in the next few segments about other gains that Diane has made in various areas with regard to her brain injury and floating. And so stay tuned for our next couple segments, and thank you so much for joining us.
Yeah.